G'day and welcome back to the channel. So in today's video, I want to show you how you can try and solve your own tibialis anterior tendon dysfunction. Basically, if you're having some pain around the tendon at the front of your ankle, where that tibialis anterior muscle sits and crosses across the ankle into the foot, then I want to show you some exercises that you can do to try and resolve those symptoms, but also get to some potential hidden underlying causes of those symptoms, so that obviously you can rest easy long term that it's not going to come back and haunt you again. Now again, for anyone who doesn't know, that tibialis anterior muscle sits on sort of the outside of your shin. The tendon almost crosses across the shin towards the inside of your foot, and it's responsible for dorsiflexing your ankle and pulling your foot back towards your shin. Now, the really interesting thing about this, as like most tendons that cross the ankle, it's very, very, very highly influenced by what's going on at your ankle in terms of joint stiffness and capsular stiffness. And what I tend to find clinically is if you do have some dysfunctions through the front of the ankle there, it's very likely that underneath that there's some capsular restriction that's changing the way that you're loading up that tendon and setting it up for altered loading, altered sort of pressure and long-term dysfunction over time. Now, the really interesting about anterior to tibialis tendonitis potentially is that it can often be either confused or affected by some anterior joint impingement. And this may sound a little bit strange considering that, like we've done in a video before, if you can free up some of the stiffness at the back of the ankle, that tends to improve the way that the front of the ankle works, gives it more space to play in, gives you less chance or opportunity to jam that ankle up at the front. So what we're actually going to do in this video is we're going to use a power band to free up not only the back of the ankle in case that's occurring in your instance, but we're also going to show you how to tailor this to the front of the ankle as well, in case that anterior ankle tightness is the underlying cause of that sort of tendon dysfunction as well. So what we want to do to start with is we want to take a baseline measurement of how things feel for you. So whether that's just walking around gently, whether that's doing some deep sort of squats to see how far you can go before your ankle starts to feel sore, even if you're leaning up against a wall and very, very gently doing some bilateral dorsiflexion or single leg dorsiflexion just to see how that tendon feels for you. What we can then do is we can then put you into a power band here. We can have this above the front of your ankle. Hopefully it's not annoying the symptoms at the front there. You can stretch the band out as far as you feel comfortable, and by gently bending your back ankle without letting the knee cave in, I'm going to stay here for 30 seconds, a minute, 2 minutes, whatever you feel comfortable, until you feel some pressure in the ankle start to subside a little bit. And then once you've done that banded ankle stretch, recheck your movements and motions again. So if you did a double leg sort of dorsiflexion or a single leg dorsiflexion, whether you have to walk or run around, recheck your movements to make sure that it feels a little bit looser and a little bit better straight away. Now again, as I was saying, the really interesting thing about this is that we can also apply the same exercise to the front of the ankle by rotating everything around. And I'll change feet just to make it easy for you to see here. But what I want you to do is, again, pulling the band back as far as you feel comfortable. But this time, we're going to try and go into plantar flexion, full plantar flexion. So you can have your toes on the ground if you want to, and then just move it around to see whether you feel you can find some really interesting tightness at the front of the ankle here. But if you really want to ramp this up, if you place the back of your toes on the ground, you'll feel this really intense stretch through the front of the ankle joint. So again, this is an ankle joint capsular stretch. It's really good at opening up the front of the ankle, potentially getting to that underlying tightness that may be causing some of that tendon dysfunction over the top. So you need to make sure that you find that this is the best version of your stretch. So you can gently rotate your leg around or twist your ankle around, and you can also leverage backwards on top of that by digging your feet into the ground and pulling back a little bit further if you need to. But the goal here is that you're looking for your best stretch possible. So you go more towards your big toe or towards your sort of the middle toe or towards your little toe. You should be able to find a position that really opens up the front of that ankle in ways that most traditional stretching doesn't get to. And then once you've done that again, you can gently walk around, recheck your sort of dorsiflexion exercises, whatever you feel you need to do. And what we're looking for is that that whole area feels a little bit more flexible, a little bit less tight, a little bit more mobile than it was before. So the banded ankle stretch is potentially one of the best exercises to do in this instance, mainly because that hidden sort of joint stiffness can really go overlooked, particularly if it's contributing to that dysfunction close by in that tibialis anterior tendon. Now, the second exercise, or the second type of exercise we want to go through, is using a tennis ball or a lacrosse ball or a bunch of balls taped together to form a peanut. Now the peanut is often a great choice to use here because of the little divot that's created by the balls. Is a great cradle for the shin bone to sort of fit into. But we want to start high up at the base of the knee almost, towards the top of that shin. You'll need to roll a little bit towards the outside to go looking for anything that feels a little bit tight, a little bit tender. Now be careful because it can feel very tender here. This isn't necessarily an area that we generally get massaged a lot. The calf's the one that tends to get all the TLC, but you might find there's a whole bunch of tightness and restricted tissue through the front of this shin that you didn't realize was there. And then once you've found it, again, I found a good spot here, I can get you to tense up that tissue underneath. Spend some time with your tib-ant muscle tensed up for about 5 to 10 seconds. This gets your brain and nervous system involved. It's a great way to really allow that tissue to give and relax once you relax. And then we can move a little bit further down. You're looking for anything that feels tight and tender. Give it a good squeeze. Try and hold that for a couple of seconds, then relax again. You'll find that as you come down lower and lower and lower towards the actual front of the ankle itself, there may be a whole bunch of tightness here that you didn't know existed, that you can then spend some time just gently freeing up. Now, as you get down towards the base of the ankle, what you can do here is if you can find a spot that feels particularly tender, I can then get you to wriggle that foot around. So we can lean back on the ball, put as much tension through this as you feel comfortable, and hopefully you can see down there, we just want to try and rotate or plan to flex that ankle. Essentially what I'm doing here is I'm trying to compress the tissue and shear that tissue free. Because this doesn't feel immediately tender for me, I can put a little bit more of my body weight down on that, and then I can get a little bit more of an intense sort of mobility exercise by doing that. Now, obviously, if that position is awkward for you and doesn't feel comfortable, you can definitely do the same thing with your fingers and your thumbs, where if you get some cream out, some moisturizer, go hunting all the way down through the front of that ankle, particularly towards the base of that ankle, towards the base of the shin, towards the top of the ankle. You'll find a bunch of tissue there that you can sort of massage out, or if you find a really tight spot that feels a little bit tender, you can compress that and then you can basically move your ankle around. You can do it this way, again, if you have the flexibility to get in there, dig in there, and then move that tissue around, try and create some shearing forces through that ankle to restore the sliding surfaces, get some of those restrictions to give if possible. But the net result always needs to be that once you've done that, you move around afterwards and it feels immediately looser straight away. But the goal of these sorts of things is if you can free up the joint underneath and get the tissues that feed into that area to free up, then you can start to restore some normal loading to the area and hopefully get that tendon or that dysfunction to settle relatively quickly. Now, there's a left of center idea here that I also want to throw out there. As we always try and do on the channel, we need to try and understand why tissue becomes dysfunctional in the first place. And if you're someone who has a distinctly one-sided foot tendon issue or ankle tendon issue, there has to be a reason why one particular side has become that way and the other side is relatively normal. Even if you have it on both sides, generally one side tends to be a little bit more symptomatic than the other. Generally, there's a more central or more proximal cause for why a lot of this tissue becomes dysfunctional in the first place. So the other thing that I want to promote here is that in some cases, a lot of this sort of stuff can actually be a consequence of some lower back dysfunction, in that the joints and the tissues of your lower back can become a little bit restricted, and the nerves that come from those areas can become tight or dysfunctional as they make their way down through the leg to supply the tissue that you find is dysfunctional as well. So another great exercise to do is, again, if we take the ball, and more specifically maybe one ball for this exercise, but a peanut works just as well as always, is if you place it right down the base of your back, not right on your tailbone, not on your sacrum, but just at the base of your lumbar spine. And again, as we do a lot on the channel here, using a ball to free up these stiff segments of your spine is a great way to make some very fast and effective changes without a lot of effort and without a lot of time. So again, what we want to get you to do, depending on if you've got one ball or two balls, we just want to get you to shift from side to side to get a sense of which side feels a little bit stiffer, which side feels a little bit tighter. We want to spend some time gently pressing the ball into the spots that feel the most stiff, trying to release those handbrakes, get that tissue to give and normalize, restore as much more function to the area as possible. And again, get that neural tissue, whether it be some referred dysfunction or some mechanical dysfunction through that neural tension, for example. We want to make sure that we restore as much normal motion to the parts of the body that can influence that ankle and the tendon more specifically. So again, make sure you do all of your lower limb tests first, the things that you know stir up your symptoms. Then just do some lower back mobility. Stay here until it frees up. Change sides or move up a little bit higher, depending on where you feel you need that mobility, where that stiffness tends to be. And then again, once you've done that, stand up and recheck your motion again. And with a little bit of luck, hopefully you'll find that the symptoms in that area aren't necessarily as bad as what they were before. Now, it goes without saying, obviously, if you have a genuine tendinopathy, what's also important to remember is that it's somewhat unrealistic to expect that by freeing up your back and some of the surrounding tissue relating to that tendon, that you will cure this issue straight away. It's important to remember that it takes time for a genuine tendinopathy to become a genuine tendinopathy. So what I want to promote in this video is that these factors can absolutely improve your symptoms relatively quickly. But it's really important that you take a long-term approach to improving the load of those tissues so that it can also remodel itself back to where it needs to be. And one of the best ways to, I guess, manage a tendinopathy specifically by loading it up and doing lots and lots of reps, most likely eccentrically, where you're sort of lengthening that tissue under tension. And so what I want to do next is we want to go through some load-related exercises, and one in particular, which is essentially one we've shown you before. So what we want to do here is we can take you through the very simple dorsiflexion exercise with an eccentric loading component to stress that tissue in a way that will cause some of that tendon to remodel over time. Basically leaning up against the wall, and the further away your heels are from the wall, the harder it will be for you. Ideally, we would have you up on a step so you can really accentuate the ability to go into plantar flexion. But a great way to start is literally doing some double leg foot taps or some tib ant raises. Go through this about 15 to 20 times, really get some fatigue, taking it all the way up and then slowly lowering yourself back down again. If you find that this is uncomfortable, what you can do is you can use your opposite leg. So for example, if this is my sore leg, you can basically come up together and then just lower yourself down slowly on the other side. Come up together, lift your leg up, slowly lower yourself down on the other side to really bias that eccentric phase, like you would if you're doing a calf raise where you're coming up onto your toes, lifting the leg up and then slowly lowering yourself down. So I genuinely hope that was helpful. If it was, let me know down in the comments below which particular exercise you maybe haven't thought of before, and hopefully the ones that you feel are making a genuine difference. If you do like this type of content, please like and subscribe to the channel. And if you did find this genuinely helpful, please consider telling someone and sharing this video to someone who may benefit from it as well. But also consider leaving a super thanks donation. It's just a great way to help support the channel and allow me to keep making these videos. But at the end of the day, thank you for watching, and we'll see you next time. Bye.